Before using Goserelin, make sure to read the Patient Information Leaflet from your pharmacist. This medication is an implant that releases hormones slowly into your body and is placed by a healthcare professional through an injection under the skin of the lower abdomen. The implant will be completely absorbed into the body over weeks or months. The dosage for the 3.6 mg syringe is usually injected every 4 weeks, while the 10.8 mg syringe is usually injected every 12 to 13 weeks. It's important to follow the dosing schedule carefully to get the most benefit from it. Your doctor will determine the dosage based on your medical condition and response to treatment. In the first few weeks of treatment, hormone levels may actually increase before decreasing, causing new or worsening symptoms. This is a normal response, but if you experience any concerning symptoms, be sure to tell your doctor right away. For women, menstrual periods should stop when using this medication regularly. If regular periods continue after 2 months of treatment, notify your doctor promptly. The implant will be slowly and completely absorbed by your body, so it usually does not need to be removed. However, if you experience serious side effects or other problems, your doctor may remove the implant. Remember to inform your doctor if your condition worsens. Some common side effects of Goserelin implant may include hot flashes, dizziness, headache, increased sweating, decreased sexual interest/ability, trouble sleeping, nausea, change in breast size, vaginal dryness, hair loss, pain, bruising, bleeding, redness, or swelling at the injection site. However, many people using this medication do not experience serious side effects. It's important to tell your doctor right away if you experience any serious side effects, such as vaginal burning/pain, pain during sex, breast pain/tenderness, new/worsening bone pain, new broken bone, burning feeling in feet/toes, swelling of the ankles/feet, unusual tiredness, signs of kidney problems, stomach/abdominal pain or swelling, and mental/mood changes. In some cases, this medication may cause your blood sugar to rise, leading to or worsening diabetes. If you experience symptoms of high blood sugar, such as increased thirst/urination, it's important to notify your doctor immediately. If you already have diabetes, make sure to monitor your blood sugar regularly and share the results with your doctor. Seek medical help immediately if you have very serious side effects, like symptoms of a heart attack or stroke, fast/irregular heartbeat, severe dizziness, fainting, severe back pain, numbness/tingling/weakness of the arms/legs, inability to move, painful/difficult urination, blood in the urine, or signs of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. It's also important to note that this is not a complete list of possible side effects, so if you notice any other effects, make sure to contact your doctor or pharmacist. If you experience any side effects, it's essential to seek medical advice. Before using Goserelin, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's important to discuss this with your pharmacist for more details. You should also inform your doctor or pharmacist about your medical history, especially if you have a history of abnormal vaginal bleeding, diabetes, alcohol use, smoking, bone loss, heart disease, high cholesterol, stroke, urinary blockage or spinal cord problems in men, and mental or mood disorders. If you have diabetes, Goserelin may affect your blood sugar control. Make sure to regularly check your blood sugar levels as directed and share the results with your doctor. Your doctor may need to adjust your diabetes medication, exercise program, or diet. Goserelin may also affect the heart rhythm, causing serious symptoms that need immediate medical attention. The risk of this condition may be increased if you have certain medical conditions or are taking other drugs. Make sure to inform your doctor of all the medications you are taking and any medical conditions you have. Low levels of potassium or magnesium in the blood may also increase the risk of heart rhythm issues. It's important to talk to your doctor about using Goserelin safely, especially if you are using certain drugs or experiencing conditions such as severe sweating, diarrhea, or vomiting. Older adults may be more sensitive to the side effects of this drug, especially regarding heart rhythm issues. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor. You should not become pregnant while using Goserelin, as it may harm an unborn baby. It's crucial to use reliable non-hormonal forms of birth control while using this medication and for a certain period after the last dose. If you become pregnant, make sure to talk to your doctor about the risks and benefits of this medication. It is not recommended to breastfeed while using this medication, as it is unknown if the medication passes into breast milk and may pose a risk to the infant. Make sure to consult your doctor before breastfeeding. When using Goserelin implant, it is important to be aware of potential drug interactions that could affect its effectiveness or increase the risk of serious side effects. Make sure to keep a comprehensive list of all medications and products you are using, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is crucial to not make any changes to your medication dosage without consulting your doctor first to avoid any potential risks or complications. If the Goserelin implant is swallowed, it can be harmful. If someone has swallowed it and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important to take this medication as directed by your doctor and to not increase your dose or use it more often than prescribed. The implant is usually placed under the skin every 1 to 6 months by a healthcare professional. It is important to discuss the best timing for the implant with your doctor. Make sure to keep up with your regular lab and medical tests, like blood sugar and hormone levels, while using the Goserelin implant. It's important to attend all your medical and lab appointments, so don't miss them. If you have any questions or need more information, talk to your doctor. Make sure to take your Goserelin implant as directed by your doctor. If you happen to miss a dose, be sure to contact your doctor or pharmacist immediately to adjust your dosing schedule. It's important to note that missing a dose may cause sudden or unusual vaginal bleeding, also known as breakthrough bleeding. So, be sure to stay on top of your dosing schedule to avoid any potential side effects. When it comes to storing your Goserelin implant, it's important to follow the specific instructions provided by the brand you're using. Always check the product package or consult your pharmacist for guidance. It's crucial to keep all medications out of reach of children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly dispose of the product and it reaches its expiration date or when it is no longer needed. If you're unsure about the proper disposal method, be sure to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.